When I was 12 years old, I went from being a really active kid to not being able to get out of bed. I missed nearly all of middle school, and in the years that followed, I bounced from doctor to doctor trying to find answers. It took me 7 years to get my first diagnosis of ankylosing spondylitis, and through that process, I learned that the healthcare system is very difficult to navigate, and unless you are fighting for yourself, you're not going to get the care that you deserve. And that fight is what led me here, to becoming a board-certified patient advocate and launching Chronically Advocating. And my story didn't end with that first diagnosis. I ended up acquiring a couple more chronic illness diagnoses as well as rare diseases. And throughout that, I had to fight my insurance company the whole way. I learned the language of medical appeals, physician jargon, how to navigate my medical plan in order to get the care that I needed and the prescriptions that I needed. And because of that, I became the person that everybody started to come to. Family, friends asking about their health plans, how they can get in to see this particular physician, how they can get the care that they deserve. And I just became a wealth of knowledge and information because I had gone through it myself. I was the one that understood the fine print. And then one day I realized, with the help of my lovely husband, that there's a ton of other people out there that are dealing with exactly the same issues that I am. And I have this breadth of knowledge that I could potentially share in order to help them navigate the system without as many barriers as I faced having to learn it alone. That's when I decided to turn all of this experience that I've gone through into a career. So what does a patient advocate exactly do? Well, think of me as a guide that helps you through the maze of healthcare. I can help you to decipher your medical benefits information, to help you with the denials of prior authorizations that happen very frequently, to help explain and overturn medical billing errors. It can also help you prepare for medical appointments and vet specialists and find them for some of the most niche and rare conditions. The key is I'm 100% independent. I work for only you. I don't work for anybody in the healthcare system. I don't work for physicians. I don't work for hospitals. I don't work for insurance companies. So my loyalty is 100% to you. It's important to note that not all advocates are the same. There are some advocates that are highly specialized in very critical areas like elder care, on different legal issues, as well as even one particular condition. So what's my specialty? Well, I help individuals with rare disease, chronic illnesses, and complex medical conditions because I've been there, I've lived it. I know the roadblocks, fear, and frustration that patients face, and I know how to navigate around them. I built Chronically Advocating for people like a working professional who has a family and kids and a complex medical condition that simply cannot spend hours on hold. A caregiver who's managing appointments and medications and stacks of insurance paperwork and just needs some relief and clarity. And the health-conscious patient who wants to take charge of their care, but is tired of feeling rushed and dismissed. If you are in the United States, whether you have commercial insurance, Medicare, Medicare Advantage, VA, or TRICARE coverage, I can help you. I can help you find answers, fight for coverage, and help you feel less alone in the process. My mission is simple: to help you feel informed, empowered, and in control of your healthcare journey. If any of this resonates and you're ready to stop feeling overwhelmed and start feeling in control, you can always visit chronicallyadvocating.com and see how we may be able to work together. So that is my big, fantastic news, that Chronically Advocating is finally launching, and I will be available to you to answer any of your questions in relation to your patient journey. If you found this helpful, please give it a like and consider subscribing. And YouTube thinks that this video is going to be of interest next.